very first day, I learned how to do a high-quality neurological exam, which is really what makes a neurologist, is to be able to examine a patient's nervous system. And it was like a burning bush. There was no turning back. I knew at that moment that I was destined to be a neurologist, and that was why I did a PhD in neurosciences. Physicians and scientists, continue to explore, continue to want to do it better. The overarching philosophy in stroke care is that time is brain. At Intermountain Medical Center, our average time to treatment is about 35 minutes, which is about 23 minutes less than the national average. So when patients get treated earlier, they have better outcomes, which means less disability. Our overarching philosophy is to keep the patient in their community when safe and when possible.
So Stroke Telehealth Services is when a patient can see a neurologist real-time in their room virtually via a camera. So they'll get the same level of neurology care as if that neurologist was right in the room with them.
Telestroke, most simply, is providing an emergent consultation from a neurologist about a patient who's having a stroke.
The physician can then ask the patient to raise their right arm or their left arm. They can listen to them speak. They can do a full stroke scale analysis on that patient without actually having to be in the room and interact just like you and I would if we were in the room together.
This helps our rural communities by bringing the expertise of a stroke-trained neurologist into a rural community where a stroke may not happen, but once every few weeks or once a month.
With the rollout of our Telestroke services, our ability to deliver high-quality care and dissolve those stroke clots sooner has rapidly increased, which leads to better patient outcomes, shorter lengths of stay, and ultimately a lowered level of disability in the patients that we serve.
There's a few ways in which stroke care is advancing over the past 10 years. One is where the interventional radiologist goes up through an artery in the leg, up into the artery that's occluded in the brain, and then squirts a little bit of the TPA onto the clot. So the hope is that that breaks up the blood clot. It's called endovascular therapy for acute stroke. The second category is where the interventional radiologist puts a wire into an artery in the leg, then goes up to where the blood vessel in the brain is blocked, and then they can use a small vacuum device or a stent device or kind of a little hook to pull the clot out of the blood vessel. We have a central organization, we have a group of physicians that are pulling together to improve quality, to improve value.
Our clinical program was really the engine that drove the implementation and the expansion of the Telestroke service. With our physician leadership, our strategic relationships with all these local hospitals, by partnering with all of them, we were able to deliver that clinical expertise. I feel very fortunate to be in healthcare, and I feel very fortunate to work for an organization whose mission is to help people live the healthiest lives possible.